This is alchemy, empowering those who care. Owners, caregivers, they gon' get you there. Expert insights, real stories, and more. Real strategies to help you grow for sure.
All right, welcome everybody to the Alchemy Podcast, where care meets innovation. Today, very excited to have a good friend of mine. We've become friends over the past couple of years here, Dr. Neal Patel. He's a board-certified family medicine physician who is bridging the gap between conventional medicine and progressive alternative therapies. He's based in Orange, California, and he specializes in geriatric care and cognitive health, volunteering closely with the Alzheimer's Orange County organization. He's been twice recognized by the California State Senate as an expert in medical cannabis and passionate about advocating for integrative modalities like psilocybin, fasting, and red light therapy. So we'll get into that. Thank you, Dr. Patel, for joining me today.
Thank you so much for having me, Ilya. It's so nice to be here.
Yeah, we met at a conference. I think it was 3 years ago? Almost 3 years ago.
I think so. It was a summer. I think I want to say 2 or 3 years ago. Definitely. Yeah, I was at a senior living conference, and I remember I'm a doctor, but I'm very into IT, and to this day I'm like, man, you're alchemy still. I always think about alchemy as a very nice platform and just easy, just simple to use. So that always caught my attention. Yeah,
we hit it off. Kind of had similar thoughts about the industry and stuff like that, and it's always fun to catch dinner when I'm down in Southern California. For our audience, give us an introduction. Tell us a little bit about yourself, how you got into medicine, and kind of your journey to your niche, right? How'd you get here?
That's a great question. I was a little shy to talk about this back in the day, but now I'm, grateful for what I do. Honestly, to be quite frank, I'm Indian Patel. You may have met a Dr. Patel in your life at some point. I did not personally really want to go into medicine. I had some family pressure. I basically decided, I'm going to try it out. I'm going to make the most of it. Long story short, I wanted to do family medicine because I believe it's the most versatile type of physician, even though most people may want to specialize. The body's amazing, absolutely phenomenal, and I want to be the jack of all trades. So I decided family medicine. I was very fortunate that I got a chance to work in a lot of different healthcare settings. After I graduated residency, I worked in an urgent care. I worked in another private practice. I did Social Security's work for benefits. I worked with Veterans Affairs. I did tattoo removal with Homeway Industry. And I worked at the LA County jails as a physician in the Twin Tower Correctional Facilities. So I was doing all these different things, but I knew I wanted to do private practice. So long story short, I've been in private practice in the city of Orange County for about 5.5 years. And my personal philosophy in medicine is fewer pills, fewer procedures, fewer doctors, the better. And my goal is always to help my patients help themselves. I do practice standard conventional medicine, prescribing medications, but I'm holistic like you touched on. I fast. I believe in red light, psilocybin, frequency, sound of medicine, and of course, cannabis. And at this time, I do lecture at the Alzheimer's Orange County.
So how did you get into, because I imagine you have some stories to tell with the county jail, right? But
yes.
How did you going into general practice, how did you pick the elderly population specifically with Alzheimer's and things of that nature?
Yeah, it was interesting. It kind of just happened. I was looking for private practice, and you have to understand the demographics and the shift. A lot of older doctors are retiring. And so I was looking. I didn't want to start my own practice. I thought that was a lot more of a uphill battle. And so I started looking around. I don't know if you believe in higher power, but sometimes things just work out. And I had a family friend, met this doctor, and he was looking to retire. I was looking to take over. So I acquired his patients, and a majority of his patients were geriatrics. So it wasn't like I have a fellowship in a sense, but I started to learn, and then I made house calls, and then I started to go to these residential assisted living facilities and memory care. And I was like, wow, who owns these? What's going on here? And I'm very passionate about education, and I've always been like that. And I was like, you know what? I see a lot of my elderly patients struggle with memory, Alzheimer's. I see how it affects their families. So I was thinking, this is something really important for the social public or the public to, first of all, be open to talk about. and to know there's things that they can do in their power. So that's how I really got into the memory side.
Yeah. So what kind of have you seen? What have you seen in the elderly care space as you've met with people? What are some positive things in health that are being taught? What are some things that, I mean, you kind of talked about more drugs, and I think that's one of the areas which we hit off, right? I remember in our facility, there was two instances. One, we had a resident who was very combative, and I don't remember the exact medication. Maybe it was a lorazepam or something like that. And they kept upping the dose, didn't do a dang thing for her. The one thing that worked, and we told the doctor, was like, hey, these Werther's Originals are the things that like are keeping her calm. He's like, okay, discontinue the lorazepam or whatever it was, and give the candy. The other example is, I remember this one resident, she came with, it was 28 different medications, and she was just a mess, just as you can imagine. And as the doctor started to take her off those medications, she started getting better and better and better. And I think that's one of the areas where, when our original conversations, we've kind of connected, because you believe in that too. And maybe you can talk to that, kind of what you see there in this.
Yeah, absolutely. I think, you're seeing it. I see it daily, and I'm like overwhelmed, because I'm like, I have a dilemma. Like, am I going to keep prescribing pills? Like, a lot of times we only know what we know. And unfortunately, sometimes even physicians are only trained in a certain way, where they just think inside the box. They say, hey, I went to school, you have this memory problem equals this pill equals this. It's very like algorithmic. And so for me, I saw, obviously, first of all, with memory, it's always a tricky thing. That's a very touchy subject, of course, for so many people. And so I realized that instead of medicine, I said, is that all? I really questioned myself. Is my only job description to prescribe pills? Did I go to school for all these years just to prescribe a pill? And to this day, I'm like, that's such a disservice to myself and a disservice to my patients. I'm so much more than that. And I hope other physicians will also feel that way. And so I realized that there's so much that people can do. So in terms of the medicine, the good, the bad is medicine, not in a bad way, but it's just there. It's just a go-to. Problem equals pill. And that, I just don't like that. I always think pills, prescription should be plan B. So for me, the issue is, at this time, we're still kind of encouraging that. They're like, hey, you got a problem, you got this, take a pill. The good thing is, I think a lot of people with technology, with internet, people are taking ownership of their health. So they're looking things up. They're looking for alternatives. I think people are tired of medicine, honestly. It's not me as a doctor. I think a lot of people, like, if you need medicine, take it, right? If you got issues, you just health concerns, please take it, and I will prescribe it. But there's so much in our power that I think now people are starting to realize, hey, I can do this without seeing a doctor. Because, I mean, I don't know about you, I personally don't want to see a doctor. I can't imagine my patients want to see like 20 doctors and like specialists and a dentist. And, so that's a good thing. With technology, we're allowing ourselves to be our own doctors. And I tell all my patients straight, I am not responsible for your health. You are responsible. I'm here to help you in any way I can. And so that's why I think it's a good part in medicine.
And I think we've talked about this too, is medicine can be a good thing for maybe to help you change a lifestyle, right? Like maybe you get on a blood pressure medication because you are overweight, things like that. And maybe that gets it so that you could be so you can be in a normal state, so that you can then make exercising and losing weight, so that you can then come off of it. So there's maybe a sense of, well, I'm going to get on it. I'm always going to stay on it, versus I'm going to get on this with the goal to get off of it. Right.
Yeah, absolutely. Right. Like even a lot of medicines, I'm always like, okay, what is the exit strategy? How do we get off? Right. I know a lot of patients right now, GLP-1s are a big hot topic. So I'm always like, okay, you started it. Great. Whoever started it. But I say, do you want to be on it for the rest of your life? What can we do to help jumpstart your health journey with the GLP-1? The GLP-1s are great. They work. They're fantastic. But as long as we implement it as a tool, not the solution in a sense. So I think that's the way I look at all medicines, not just GLP-1s, but that's the way I look at it. And I'm always looking for ways to cut people down on pills, even supplements. I got patients, they don't take a single prescription pill. They say, no, I don't believe in pharmaceuticals. they take 20 supplements. I said, is that any better? You're still taking a pill. Do you really know how that works? You know, so there's a lot of that. Just there's a psychology of medication that is absolutely phenomenal. So I try to break that thought process for a lot of people.
So what is that like for people? I mean, it sounds like you're saying are they more receptive to that? Like, and even in the case where you're dealing with Alzheimer's and dementia or Parkinson's, you're probably talking more to the families than the actual resident, right? So like, what's their response to kind of how you're approaching all this?
It's tough. You know, sometimes older patients, they grew up with, hey, problem equals pill. So to break that thought process, that just entire habit, is a little difficult. But what I found, like, you know, when a patient has dementia or the family, like I tell patients, like I just did a lecture 3 days ago with Alzheimer's Orange County. And I said, look, Alzheimer's dementia is not a patient disease. It's a full family thing. Everybody's involved. So it can be very taxing, not just on the patient, it's the family. And I see it all the time. And honestly, I tell patients all the time, like, what do you have to lose? Wouldn't you want to try everything in your power for the family, the patient? Because at this point, pills are not working. So I always frame it that way. I say, look, pills are there. If you need it, we're going to give it to you. But is that all you want? Don't you want to give yourself the best chance for your own health and maybe for your family's sake? So I kind of frame it in that sense to say, what would you want to do? And I kind of gauge, I try to be very open and collaborative. And I say, where do you stand? Some patients, no cannabis. I will not touch it. Okay, that's a little bit harder. I'm not here to force anybody. End of story. Fasting, you want to try it? Okay, then we try to cater it to their comfort zone. So it's always a conversation that can go south, or it depends on how strict or how rigid they are in their thinking. But to make it clear, I think people, they'll do anything. When you see your family suffer or loved one, like, yeah, they're willing to try anything. And I try to frame it that way.
I'm just curious. I just thought of this when it comes to, obviously, when someone becomes diagnosed with Alzheimer's or dementia, obviously, I mean, I would imagine that the daughter or son, there's a bit of fear that that's going to pass down to them. Can you talk about that just briefly? Like, what's that conversation like, and what do you tell people?
Absolutely. Yeah, that's a great question. You know, we get that a lot, right? Hey, my mom had it, my dad had it, my grandma had it. Am I gonna get it? Right? There's always that issue or concern. And I say, look, sure, every disease, every ailment has a genetic component. Sure, we can say that. But there's actually a study from, I think I think JSTOR, I forget the name of the article, but it was like 2 years ago in the dementia study. And they found that about 45% of dementia is modifiable, aka the risk factors are in your hand. So 45, obviously, younger people, education level, and middle age, high LDL. If you are a smoker, if you're overweight, concussion, depression, diabetes, right, hypertension, all these things add up. Hearing loss, 7%. Later stages of life, if you have visual loss, if you're socially isolated, now they say air pollution, which is kind of out of your hands. So 45%. So I say, yes, we can live with fear. Maybe there's a chance, but there's so much that you can do now to help yourself. So I say, sure, you know, you don't want to be defined by any disease, by any illness. Number one, you must live your life. Like, you cannot say, hey, I got X, Y, and Z. Life is over. No, life must continue. So I always try to give my biggest people hope, because people already come to me at their most vulnerable state. And the last thing I want to do is put them in another state of fear. And the truth is, like I said, there's so much you can do. You are the doctor. Patients are the doctor. And I want them to feel empowered in their health. And that's really key for me, because two things. Number one, like I said, I can't be responsible. Number two, there's no way I can take care of everybody. And like, obviously you're in this space too with Alchemy. Our population, not only in the US, but the world, is aging. So what are people going to do? There's no way that the entire system can stand on its own without everybody being involved. No matter what, you will be involved in senior care one way or the other. So you might as well just accept it and do something now and be proactive.
Yeah. Well, that is the great hope, and I've kind of tried to stay up on top of things, reading things. Like I saw some other
Sure.
study that said the amount of muscle in your legs, your muscle mass, also helps determine that, right?
Yes.
And I think the overarching, I think what you're saying is awesome because it's like what you're saying. Most of our health is actually in our own hands. Of course, making that change is the difficult part, but it really is ultimately in our hands, and we determine our health outcomes by what we do or don't do, right?
Yeah, absolutely. Yeah, that's the idea. So it is hard. I can tell you this and this, but that's other things. Like, how motivated are you? How willing are you going to do it? Do you want to blame X, Y, and Z for your health? Or do you want to say, hey, it's on me? So all these psychological aspects also come into play. So I try to gauge where they are, not only physically, but emotionally and mentally, because it's easy for me to say, hey, X, Y, and Z, but kids, they got bills, they got a life. So I try to meet them in the middle, meet them where they're at in their journey.
So let's kind of transition into the whole marijuana discussion, which can be controversial, right? So, like you were mentioning, some people will be all for it, some people will be very much against it. But the interesting part about this, and I've seen a couple of, I guess they were interviews or like mini documentaries, but I remember this one, which was about a Parkinson's patient. And, with Parkinson's, there's a lot of shaking, and my wife's grandfather had Parkinson's. And so I got to see kind of what that was like. And it was very interesting to see an individual who couldn't move, they couldn't control anything. And then after, taking marijuana, I don't remember exactly how they did it, but taking marijuana, like they had control, like their body relaxed. And I always found that fascinating because it's not like, I don't know, but I don't think drugs take that immediate effect, but it was pretty quick. Can you speak to any of that? And that's very interesting.
Yeah, it's great. Cannabis right now is going through all types of legal changes. There's like a day-to-day. The government's a mess right now. We're trying to figure it out as physicians. Everybody's just scratching their head, so the entire industry is all like upside down in the sense clarity. But anyway, beyond the point, the science is quite phenomenal. Cannabis, basically, the whole point is why, like you say, your wife's grandfather or father, I forget, your grandfather per se had, why it works so fast. The endocannabinoid system, real quickly, is basically, imagine your nerves, right? You got nerves, they send signals. But what regulates the nerves? So imagine your nerve, there's a spider web that sits over the entire nervous system. That is something called the endocannabinoid system. And that is what cannabis works on. Endo, self, cannabinoid. We actually make cannabinoids or kind of natural cannabis in our body. So 2-EA and anandamide. The cannabis plant, we found out, actually binds directly to those receptors in our body. So it's like a perfect synergy. So that's why, for your grandfather, you had such immediate effects because it literally binds directly to it and so fast. So we have this entire intricate system called the endocannabinoid system that is not even, we don't talk about it in med school. We don't talk about it in residency. We don't talk about it in the public because it's linked to cannabis. Forget cannabis. That system is already something that needs to be studied for pharmaceutical purposes, but it's not. So here, that's kind of why you have such incredible benefits for Parkinson's, especially because Parkinson's, you're having a disorder with the nervous system, your nerves, the receptors, the dopamine not working. So what the cannabis does, your nervous system is sending weird signals. But what's controlling the nervous system? The endocannabinoid system. So when that's imbalanced and your nervous system is imbalanced, obviously you get all these different issues. So obviously the nervous system, we can't really fix with Parkinson's per se, but maybe we can relax it. And hence, like you said, you get the relaxing tremors, they feel more in control, and all the other good things that go with it.
So what are some other uses of cannabis?
Yes,
what other
correct.
things does it help out with?
Oh, cannabis? Oh, it helps out with, I was listening to a lecture yesterday, amazing lecture. It helps out with so many things because, like I said, your nerves control everything. So that spider web controls or sits over everything, your digestion, immune system. It's heavily studied for autoimmune disorders for sure, right? Rheumatoid arthritis, heavily studied. Multiple sclerosis has been studied. for recovery, for muscle. We're finding now, we're trying to learn about cannabis and metabolism, and that's going to be huge breakthroughs, right? Diabetes, hyperlipidemia, can that affect hypertension? We have to make it clear when I speak on cannabis, because a lot of people think cannabis is going to get me high. Oh no, I'm going to get high. Look, my patients are 80, 90. They cannot have the luxury of getting high, and they just want to function. All right. They just want to be able to use their body. So cannabis, obviously you may be familiar with THC. That is what everybody thinks of cannabis. That is the high. There is something called CBD and all different types that we're learning, and that is showing a lot of promise. So when you go to like a dispensary, you go to buy it, a lot of times you're going to get high amounts of THC, and that's what gets people stoned. But there's an imbalance. It's a high THC, low CBD. That is now playing a seesaw with your endocannabinoid system. So that is a whole entire nuance within the endocannabinoid system that I'm trying to teach people about. But anyway, to make it clear, yeah, that's one. For Alzheimer's right now, I recommend it to patients all the time. I say, like you said, you had a patient on Xanax or lorazepam, upping dose. Not working, not helping. I would rather my patients try cannabis any day before trying Xanax, Haldol, Seroquel, Mirtazapine, all these drugs that are so commonly prescribed for all the side effects that come with dementia. So we're just scratching the surface on what else cannabis can do for our bodies.
It's kind of been, I don't know, last 15, 20 years or so. It's been talked about for medical purposes, but it's obviously getting more and more traction now. You mentioned a little bit about the rules and regulations. Can you speak to any of that? Like what is going on with like the legality of things? And I know I saw something about the White House lowering I forget what it's called, but from a type 1 to type 3 or something like that. So yeah.
Correct. So just a real quick history, cannabis has been around for like 5,000 years. Not a new thing. It's just a plant, right? We use plants for everything. Caffeine, nicotine is a plant, right? So it's all comes from plant. Number one. Number two, the history of why cannabis is illegal is very interesting. Long story short, cannabis was recommended as a prescription or as a medicine in the United States. So Eli Lilly, which is the drug company that makes Zepbound, Mounjaro, which is blockbuster medications, they actually had cannabis tinctures back in the 1900s. Fast forward 1930s, prohibition, alcohol was banned. They created not the DEA, I think the Federal Bureau of Narcotics back then. They realized that prohibition, alcohol, no more, hey, it's legal again. So all that department were freaking out, and they said, what are we going to blame? Cannabis. So because their budget was going to get cut, their department. So Harry Anslinger, if you ever look him up, he was the main guy that basically started the war on cannabis back in the 1930s, I want to say. 1970s, President Nixon signed the Controlled Substance Act, which basically there's something called scheduled drugs. Scheduled means there's addiction potential and tolerance potential. Schedule 1 is like cocaine, heroin, psilocybin, LSD, cannabis. Schedule 1 means zero. I've known in December of last year, in 2025, President Trump. Oh, sorry.
You cut out there when you said zero. You said you cut out there.
There's zero value, right? Zero medicinal value, Schedule 1.
Oh, gotcha.
December of 2025, President Trump, December 18th, I want to say, President Trump signed an order. All of a sudden, now it's Schedule 3, which means cannabis now all of a sudden has medicinal value. However, Schedule 3 means it's still addictive in a sense. It's still a drug, but now it's not as illegal in a sense, but it has, like I said, medical value. For patients, for doctors, doesn't mean much at this moment.
Really? Doesn't mean that it doesn't change anything? Like you're still able to prescribe it as before, or what do you mean?
No. So you have to understand, because cannabis is federally illegal, I cannot technically prescribe it. I can recommend it. So that's how that works with the wording. In terms of it, importance, like I said, it doesn't have what was I going to say? You can't really, Schedule 3 is more important for research because now we can get more funding for research dollars. You can start creating more controlled trials. With that, hopefully then we get clinical evidence, which then we can say, hey, it can help with Parkinson's, Alzheimer's. Let's be honest here. Pharmaceuticals run the show. We're going to play nice with them. Schedule 3, I want to say, is partially due to we're going to veer it towards a pharmaceutical pathway. And obviously all the pharmaceutical industries are probably salivating right now. Cannabis itself is a multi-billion-dollar industry. Let's just see how it goes once pharmaceuticals get involved. So we're just going to have to play nice with them, and that's expected. I think there is a way. Maybe all of them should do cannabis before we start having those negotiations. All the CEOs, maybe they'll be more loose. So we'll see. So that's kind of like the overview of now where cannabis stands. Yeah,
that's very interesting, though, about how, not to get political or anything, but it's just interesting how governments can they control things that maybe are not necessarily even in line with the medical community or whatever, right? Like, that's kind of interesting. And then from the flip, it could be changed.
It's the doctors are usually the lowest part of the process in changing things initially. Just like I remember, I'll never forget when I worked in LA County jails, I was a doctor in the jails, right? And sometimes we had issues with psychiatrists, maybe the sheriffs, right? I discharged an inmate from the medical side, but he is not allowed to leave because there's an issue with this, or whatever he was caught, whatever he did illegal. So I realized, yes, I'm a doctor, I'm a medical doctor, but this is a jail, and the jail supersedes any medical opinion. So I think right now I'm a doctor, I speak on cannabis, but unfortunately the administrators, the politics supersede it. And so that is why we need to work together, hopefully productively, where the doctor's voice can be heard. Unfortunately, doctors also don't speak on it that much. I think I'm just surprisingly, I don't know why, a lot of doctors are not talking about it. Obviously, it's illegal. A lot of doctors do work for big corporations, big healthcare companies, so they might be tied. And of course, their personal preference as well and personal beliefs on cannabis.
I mean, you're in the state of California, and as I mentioned in the introduction, as you'd mentioned to me, like, you've been recognized, like the state Senate is recognizing you. So what does that look like in the state there in California? Is there, like, from a political standpoint, is there more in favor of it? Do you see the trend?
Yeah, I mean, California was the first state to actually legalize medical marijuana back in 1999. It was a Compassionate Care Act. So first state, so they're pretty pioneer in that sense. Honestly, they're very weird. California also is very regulatory. They are always trying to do things. They're trying to experiment sometimes. Long story short, like, I look at it this way, as a practical clinical application. Patients, like I said, we talked about them taking ownership. They take supplements, right? Oh, every day I can sell you on a brand new supplement. It's going to cure you of X, Y, and Z. But it costs like $500 because it got a patented small little thing, right? Cannabis is no different. A lot of people, like, I actually try to lecture doctors. I say, doesn't matter what your stance is on cannabis, patients are going to do it. They're doing it. They're taking ownership. I have patients who come to me and say, hey, Dr. Patel, don't get mad at me, but I was taking Benadryl to sleep, but now I started taking a gummy. And I'm like, thank goodness. Like, please take it. Like, I'd rather take that any day over Benadryl. So, but they're uncomfortable talking to me about it. And I'm pretty open-minded. So imagine other patients talking to doctors. So California is obviously, in general, pretty forward-thinking. But there's a lot of issues on the medical side. There's a lot of, red tape or just a lot of hesitancy. The nurses got it right. They actually recognize cannabis as a nursing specialty. It's like an actual specialty. And they have American Cannabis Nursing Association. So they actually have a very professional, properly built out system for their nurses to educate on this. And I'm like, this is amazing. So I love nurses. I think they're doing wonderful. But they need to be part with the doctors. We need to work together because they cannot prescribe down the line. It will be the doctor technically. So yeah, long story short, I tell doctors, like, who cares what you feel about it? Like, it is your responsibility. It's your duty to know what your patients take. And that includes cannabis.
Yeah, that's interesting. Just thought of this. One of the things, again, when we own our assisted living facilities, right, or like we do software for assisted living right now, right, and you see all these medications, and like you said, it's important for the doctor to know what is being taken.
Right.
That's also a challenge because you have multiple doctors that are prescribing, right? And so, again, going back to the patient, they have to be the ones to make sure that they're letting all of the doctors know, hey, I'm taking these medications. This person just prescribed this person prescribed that. I mean, that probably is a challenge too, just in the industry of like getting all that information so that you do have an accurate list of meds, right?
It's tough. Look, the medical record system, the medical side, it's so convoluted. It's so choppy. It's so broken. And we try our best, right? Everybody's trying their best. Doctors are trying their best. The patients don't know half the time what they're taking. Oh, my daughter gave it to me, or my wife told me to take it. Like,
Yeah.
We don't know, right? So it's always, oh, it's in your, what I hear the most, what do you take? It's in my chart. Our chart. Oh, I went to the hospital. It's in the chart. I said, our networks, our systems do not communicate with each other. So it's a whole communication thing. I tell patients, like, please do everybody a favor. Just keep a note card, right? Keep like your medical record. Just give it like a flashcard. Like if I ever get a tattoo, it's going to have my allergies, my past medical history. That's what my tattoo will be. Open up. All right, this is who I am, right? Make it easy. So it is hard, but I think as the provider, I don't want my patients to have to rely. That should be our job as well. I don't want to put it all on the doctors, but if you don't ask the question about cannabis or medicines or supplements, it will sometimes not come up. And they say, oh, They don't take anything. No, it's not they don't take anything. They just did not think about that as a medicine or something.
Or like you said, you're open with talking about it. Other people, for whatever reason, they're not going to be so open with the doctor. So explicitly asking it kind of invites the person just to open up about it, right?
Yeah, absolutely, right? Like, I mean, as a doctor, like I keep saying, I don't want to see a doctor, and like most doctors, I think most patients come to see a doctor not when they're happy and having a great time. There's something going on. So they're already vulnerable and they're looking for help. And health affects everybody. It doesn't matter your race, your age, your socioeconomic status, it affects everybody. So I always try to make my patients feel comfortable and open, because if you can't be honest with your doctor, then who are you gonna be honest with, really?
Yeah.
So I feel like might as well tell me and in a lot of things, who else are you gonna tell? Or honestly, I'm like, you might as well tell me.
Right.
There's not a lot of people gonna share this with outside of me. So yeah.
Well, I don't know if there's I know there's attorney-client privilege. I'm sure there's a doctor-patient privilege as well.
100%.
So.
And I take that very seriously. Yes, that is whatever happens in my office, whatever we talk about stays between me and the patient, no matter what.
Talk to me about red light therapy, because I hear a lot about this stuff and how it could be good, and sometimes the claims seem like unbelievable. So talk to me a little about red light therapy. And
Ilya, it's so funny you mentioned that. I'm sorry, I'm like squirming here because I actually have a red light mat right here, and
oh, really?
I'm a big fan of it because red light, to make it clear, so let me plug this in. I can show you. Red light is basically the power of light. Let's see. Let me pull that up right now. Can you turn this off real quickly? Red light is really cool. My friend makes these. It's like these are little diodes of light. Mm-hmm. Turn it on. You see how bright it gets? So cool. Mm-hmm. And there's different types of settings. The whole point is light. What is the point of light? Who cares? It makes things bright. No, light is absolutely powerful. Plants, how is it possible that a plant can utilize just light and sunlight to create energy? What a phenomenal process. Why can't humans do that? Right? So the whole idea is there light that can actually help us? And there is. Red light. It's a type of wavelength. So red light, basically, long story short, red light is meant to penetrate your skin and touch into your mitochondria. Each cell in your body is like a cell phone. Imagine when your phone does not have a battery, what do? You charge it. Is there a way to supercharge your battery? Right, you had a long day, you've been using your phone, it's drained. Can we recharge that battery with red light? So the idea is red light is being now shown for obviously for help with skin, a lot of skin things because acne. I got some eye bag. I was looking to buy one for myself, like a mask. They got for skin tightening, acne, for joint pains. People have wrist pain. I actually use these almost every day on my knees. After I work out, I wrap this around my knees. It's got two different types of lights. It's got a red light, which penetrates to help with inflammation. And it has near infrared, which is helpful for warmth. So it's heat and the light. So a little bit of both, basically. Right. So that's the idea. Obviously, the science is still it's still a newer type of field. But like I said, I might as well try it. You know, my friend, she sells a hat. And the hat for people sometimes for balding is one. Sometimes they wonder if the light's strong enough, can it penetrate to your skull and for your brain, for memory, Parkinson's, you name it. So that's also, I personally would like to get a red light bed where you just lay basically pretty much almost naked and you just cook in there for about 20 minutes and you get all red light for your entire body. So yeah. So that's kind of the simple science behind it.
I haven't fully tried it yet, but so one of the side effects or things that I've had since my kidney transplant is I have neuropathy in my feet and my toes, and I've heard some good things. I tried once. Somebody lent us some red light therapy, and I did it, and I think it did do something. Of course, I only did it a couple of times.
Yeah.
But I also see, very very trendy on social media, right? Lots of people wearing the mask to, like you were saying, tighten up the skin and things like that. And I always wondered, is this just a marketing ploy? Is this just the next wave of things, or is there some truth to that? And then maybe you can speak to it. Like maybe some things are perceived as red light, but they're not really red light. So you can make something red and sell it, and it's not really red light therapy, right?
Yeah, you can go on Amazon, buy a red light for $20. Like, no, red light is relatively expensive. Like that mat is like few $100s, and that's with a discount. And it's like, wow, that's so expensive, but you want to pay for quality light, right? If you have a house, you put one light in the house and say, hey, I'm going to cheap out and only put one light in the house. No, you probably put like lights everywhere that you need. So the whole point is red light. I think for a lot of people, I tell my patients, quality, the biggest thing you look for usually the number of actual lights. Sometimes they have bigger light bulbs. Bigger light bulbs diffuse the light a little bit more. So you don't really get as much concentrated light. There's so many concentrated lights here. So it hits more surface area. Excuse me. That's one. So you want to look for concentration. You want to look for the frequency, the hertz. How strong is it? And there's like a whole different wavelength pattern. That's one. So yeah, Ilya, it's not a very quick thing where it's like, hey, go on this website, or hey, we saw 5 people completely cleared up their acne. It's going to work. So those are a couple of the things that I look for. It's number of lights, the power of the lights. How bright can the lights turn on? So those are one of the top two things. And then the actual surface area covers, right? If you get a big mat like this big, only has like 5 lights, that's like putting 5 lights in your entire house versus having little spotlights everywhere. So that's kind of the idea.
Right. No, that's interesting. Well, I mean, that's just, there's so many technologies and different things that are coming out. I mean, things that you thought you knew 10 years ago are now different, I mean, it's funny. There's this one, I guess it's a little short or whatever, but it's talking about like the healthcare or like health in terms of like losing weight and eating what's proper, and it's about eggs, and it's eating eggs is not good for you because it higher cholesterol. And then like the person zooms out, or it's like a Back to the Future kind of thing. The person comes back and he's like, no, eggs are good. And it's like constantly changing over the years. So it's interesting to see what might be coming down the line in terms of technology or things that are learned in science. What do you think in terms of like a healing modality? Like, what do you think will be mainstream in family medicine 10 years from now?
I mean,
which today might be considered, alternative or overlooked? What do you think?
I think, like I said, cannabis for sure. Psilocybin, very big fan. That one is going to make some really cool breakthroughs. Like I've personally done it. It's been absolutely life-changing for me, like completely life-changing. And it's one of the few things that's starting to be studied for neurogenesis, neuroplasticity for dementia. So that's the one plant. It's like not plant, technically it's a fungus kingdom. So we always get that mixed up. I'm a big fan, like you mentioned, right? Hey, do this day. It's great. Next day, it's not good. And right, there's so much conflicting data out there. And everybody on TikTok and Instagram's a doctor. Everybody's a doctor nowadays. Right. So it's one of those things. It's like, oh, who do I believe?
Well, AI probably, gets mixed in there too, right? Well, this is what AI is saying.
And that's huge. AI is a whole different thing, right? Like I'm a family medicine doctor, so I'm hoping I still got a job in 10 years. So we'll see. I think some people, I'll just say this, but I was like, unless you want a prostate exam from a robot, I might still have some job security. So I think we should probably still be okay here. So for me, AI, I think will be a tool more than a replacement. I hope, which I'm thinking, which I believe in. I think I'm a big believer in, like you said, natural things. Okay, supplements. Yeah, that's going to be taking off. That's all right. I think people will burn out from supplements. They'll get tired at some point. Red light frequency medicine, very underrated. So I think that's going to be a huge tool in the future. Vibration. We're not just a physical thing. We are a wave and a particle, technically, right? This right here. So frequency medicine, there is a doctor I met. He actually treats liver cancer with just ultrasound. So absolutely phenomenal. So a lot of power in sound and vibrations and fasting. I'm a big believer in fasting, and I think don't add things to your life, subtract. Fast. Do a physical fast. I personally fast. Do a mental fast. Cleanly. Take off time from your phone. Take off time from TV. Silence. How long? I tell my patients, Ilya, I said, I challenge you to sit and stare at a wall for 5 minutes and do nothing.
Nothing.
And they're like, I can't do that. I gotta do something. No, just stare at a wall and just be with yourself. So those are a couple of things I think are really low maintenance. If they're free, you can do it like right now. You don't need a doctor to do it. It's safe, right? Fasting, of course, there are different methods, but yes, I'm a very big believer in fasting, and the science is phenomenal on that.
Yeah. Well, it's interesting. It kind of comes full circle with we started out talking about medications, and it's like, well, subtract and you get better. And so take some of these things away. Yeah, I've heard of social media fasts, obviously TV fast, screen fast. I know that my wife was kind of on this, she read a book on screens with children, and, we can kind of see that change in our kids when, if it seems like they've had too much screen time, we go on a screen fast, I have, and it's amazing how much different, what I'm seeing is kids, but I would, same thing for adults, right? It's amazing what you do if you subtract things from what you're currently doing. So maybe that's, for the listeners, maybe that's something they could try, is do a week social media fast, or, 5 minutes sit there and stare at the wall, those kind of things. So
yeah. Simple things is very easy. Oh, I guess maybe not easy, but simple, I should say, right? It just I'm very practical, right? I never tell patients to go and fast and eat rice cakes. I don't tell patients to go delete their emails and delete just maybe 5 minutes a day, right? That's it. Something to incorporate in your life. And I always tell patients, if you got time to go bathroom, you can make time for anything. So you find time for what is important, basically.
Mm-hmm. Right.
Yeah.
Well, this has been a great discussion. I appreciate the time. Anything that you'd like our listeners to know, which would be people in the assisted living world community, last thoughts you have?
Yeah. First of all, I'm so glad, you're doing this, Ilya. It's so important to educate the public. And like I said, I've still always been a fan of Alchemy. I think you guys have a great product. So I just hope you guys such good success, because it's very well needed. Because that part, the medical record, or having a system that everything is aligned, is just huge. Communication is a cause of probably 60% of all medical errors. And so having a system like Alchemy, where it's just simple to use, and that itself doesn't cause burnout, I'm a big fan. So I really appreciate what you're doing. For me, for listeners, I just want to say, look, it's in your hands. You have the power. I want to empower you as a person, as a human. I know it's hard. You got to do your homework. Some people don't want to hear it. They don't want to exercise. They don't want to eat well. But like I said, you have so much potential that you can do yourself without seeing a doctor, without taking anything. So it really, I want to give people a lot of hope. Yes, there's a lot of scares, a lot of medical issues going on, and dementia and diabetes and whatever, and cancer. But does that mean we're hopeless or powerless against these things? Absolutely not. We are the most adaptable species in the world. We are the most intricate species, and we will continue to survive. But do you want to survive or do you want to thrive? And that is the difference between the lifestyle and the life you live. So I want to get people hope.
That's awesome.
Yeah.
Well, thank you so much. How would people, if they wanted to get in contact with you, they're in the Orange area or want to partner with you, like you said, and advocating the medical community, like what's the best way for them to get a hold of you?
You know, I do some social media myself. I'm not too big of a fan. It's kind of burning me out in a sense, but I think social media or LinkedIn, I can put it later, but that's probably the best way to reach me. I do have my office. You can always reach out that way, but my handle or whatever it's called, Instagram, is at Dr. So Dr. Neal, Neal, as in Larry, H Patel, Patel, at Dr. Neal H Patel. You can, connect with me there. I always put a lot of informational stuff out there, simple, practical things. LinkedIn, of course, I'm on. My office number, if people want to join or be a patient, it's 714-771-2800. And so, this
has been great. I appreciate it.
Absolutely. No, thank you for this opportunity. And obviously wishing you guys, Alchemy, your great success as well.
Thank you. Appreciate that.
This is Alchemy, empowering those who care. Owners, caregivers, they gon' get you there. Expert insights, real stories, and more. Real strategies to help you grow for sure. This the Alchemy Podcast. Creating better spaces, it's much to share. This the Alchemy Podcast. Help you build, grow, and thrive in the future of care. This the Alchemy Podcast. This the Alchemy Podcast.